Okay, we are now live on Facebook. We'll get started in a few minutes, let more people come in.
Just give me the signal when you want to get started.
All right.
I hope it's okay. I joined. I think I saw the notice on Facebook and I thought I might pop in and see what your session was like today.
Yeah, thanks for coming, Jill.
It's a great way to wrap up the week.
Absolutely. Absolutely.
Yeah,
It's
hi,
great,
John. How are
great
you?
to be on the call. So thanks for the invite.
Nice to see you.
Yeah, you kind of got the green shirt, you got the blue, you got the who's your player? Is it Salvi? Because I got my catchers,
Oh, nice.
So
Very nice. Very nice. Yeah. I guess hopefully eventually, since the season's so long for baseball, I guess, there's still a possibility that we might be able to catch some games.
I miss baseball terribly. It's just that pastime. It's in the background if you're not watching it. And I just miss it. I just miss it terribly. I just hope they bring it back in some form, whether it's playing at an empty stadium. I don't care. Just pipe it in,
True fan. That separates the true fans from just the.
Oh, there was a lot of lean years going with my 3-year-old daughter. She was doomed to be a Royals fan from not being one, because she just got put in there at a very early age, So, yep. Is everybody staying safe and healthy, I gather? Everybody hanging in there?
Yeah.
Yeah.
As much as possible. Yeah. I mean, everybody's safe and healthy on my end.
Good.
I got a care package for my mom. It's like 10 different masks. She should.
Oh, yeah.
Like different styles. And I don't know.
Yes.
I need too many styles of masks.
We should have like a COVID-19 catwalk, and you could just like model them, and you could accessorize it with, blue and green.
Oh, I would love that, Brendan, if you did a series for the Instagram.
Various masks.
For our Groundwork Energy Instagram. You could do a TikTok.
We're going to reach out to do that with the kids over the summer virtually. So that might be.
Yeah, that'd be great.
Yeah.
Your mom said it'd be a great way to trick them into learning science. Check out.
I like your guys' background that you put in there. It looks great.
Thank
It's
you.
It's all Dejan. I can't point. You guys don't have the same screen as me.
It actually worked. Yeah, I am next to you on my screen.
You're next to me as well. You're that way.
Yeah.
You guys would say Dejan's over there for me and Rachel's next to me on that side. I can't be, so it's very confusing.
All right, well, I guess we can get started, and as people come in, you're welcome then.
Are you having to monitor and let people in pretty much, or? Okay. I did pass along this. We have an intern that's working with us this summer, and she just started, and her name's Alyssa Butner, and I passed on I forwarded her the invite, so she may be joining.
I believe she's on actually, and we're about to do introductions, so I think she'll get a chance to introduce herself here in a minute.
Great. Oh, great. I can't see that, so that's fantastic. Thanks.
Yeah. Well, thank you everyone for coming. A pleasure to see you on this Friday afternoon. As Jill put it so well, it's wonderful to kind of cap off the week with this small virtual gathering. So we appreciate you taking the time to be here, and we're just going to start off the meeting with some quick introductions. So Rachel Jefferson, I'm the Executive Director of Groundwork Energy, formerly the Historic Northeast Midtown Association, and I'm going to turn it over to Dejan.
Hey everybody, I'm Dejan. I'm the communications and community planner for Groundwork Energy. Now I'll pass it on to Brendan.
Hi, I'm Brendan Irvin. I'm the Administrative Assistant and Youth Program Coordinator. Sometimes I forget my program in that for Groundwork NRG, formerly the Historic Northeast Midtown Association. And I'm going to pass it on to Cynthia below me.
Hello, everyone. My name is Cynthia Isa, and I'm the Economic Development and Sustainability Coordinator at Groundwork NRG. It's good to see you all.
Dustin.
And I am Dustin Hare. I am the Census Equity Coordinator for Groundwork NRG. And let's see, who do I know? I'll pass it on to Elnora.
Oh, wow. Okay. Yeah, Elnora, and I am current president of the board of Groundwork Energy. Hello, everybody.
Hello.
And I will pass it on to whom? Let's see. Bob Amber. I'm going to pass it on to Bob.
Well, everything has been very good in the homes. We had a little standing water after all the rain yesterday, which is subsiding. So far, we haven't had any COVID-19 cases in our 1,000 residents at the homes. So we did cancel our meeting. So if anybody was planning to attend, I will put it on the Facebook and on Nextdoor, but we canceled the meeting for next Tuesday because we feel that it's still a little too soon to get everybody together. So our next meeting will be the first Tuesday in July.
Great.
How about Jill? Do you want to introduce yourself?
Yes, thank you. I'm Jill Peltzer, and I am an assistant professor at KU School of Nursing and a resident in Wyandotte County. And I've been working with Rachel on a project. Actually, Rachel and I work on 2 projects, and Elnora is working on the project with us. So thanks for the invitation.
All right, and John?
I'm Jonathan Harrington. I'm with EPA Region 7. I've been working more closely with the Kansas City, Kansas Wyandotte community. Great community to be working with. Been working with the Groundwork USA and now Groundwork NRG community, as well as working with a job training grant with El Centro that was just awarded. And also there was 2 grants that they're just awarded as well, an assessment as well as a revolving loan fund grant. There are brownfields grants that also involve as a coalition partner, Kansas City, Kansas, Wyandotte County with those. Very exciting times. And of course, the Quindaro town site. So you guys got a lot of things going on, a lot of good things, a lot of hard work that's just really starting to pay off and got a lot of momentum going, and we just need to keep it going. So great to be on the call today. Thanks for having me.
Right, and Alyssa.
Hi, I'm Alyssa Bittner, and I'm an intern with the EPA Region 7, and I go to K-State when I'm not in the summer.
How about Yvette? We're doing introduction.
My name is Yvette Cosby. I am a community member, basically, and I'm retired, so I volunteer with several organizations. And this is one of them, kind of.
Great. And then we have our Dallin. So this one says iPhone 8297831. If that's anyone.
Sit down. No, not get down. Sit down. Sit down. Come
Okay,
on.
we'll try to come back. And then caller 913-484-6252. If you want to introduce yourself.
Hey, Joe. Come on.
Okay, how about 913-461-5892? Okay, and caller 913-342-6249. Let's try to unmute. Oh, wait. I think we might have time. Okay, well, we'll come back around to introductions if we missed anyone. We're going to get started. Welcome to our second quarter virtual gathering. I'm actually really excited about this because this is our first quarterly meeting of the year since the previous one got post or canceled. So welcome, welcome. We're going to get started. All right, so first thing, like I'm sure many meetings that you've been to, we just wanted to start off and talk about COVID and what we know and what we don't know. And Cynthia is going to lead us on this.
Yes. So, as we all know, we're about 3 months into the COVID-19 pandemic, and we just wanted to provide a little bit of information about what we do know and what we don't know about the pandemic and some of the impacts it might have on our communities in the near and far future. And so just to start as a general overview, and I'm going to ask that everyone hold their questions till the end, but just to start as a general overview, what we know about COVID-19. COVID-19 emerged from Wuhan, China, which is a city with a population of around 11 million, in December of 2019. And by December 31st, Chinese health officials had reported to the World Health Organization that there were 41 cases of a mysterious pneumonia. We know from experience now that over the next couple of months, the mysterious pneumonia that they had identified in Wuhan, China, spread from China to countries ranging from South Korea to Italy to France to London and eventually the United States. And now we are responding ourselves. So we know that COVID-19 symptoms usually appear within 2 to 14 days after exposure. And these symptoms can range from mild to severe and include such symptoms as, fever and chills, coughs, shortness of breath or difficulty breathing, fatigue, headaches, loss of taste or smell, sore throat, runny nose, nausea, vomiting, diarrhea. And in the youth, there have been several cases where a stroke was the first symptom of COVID-19 that a young person expressed. So we do know that the range and severity of symptoms, there's a pretty big range, and that about 80% of people who come down with COVID-19 do recover. 1 in 5, or about that extra 20%, do develop more severe symptoms and potentially life-threatening conditions towards the end. Next slide. So how does COVID-19 spread? COVID-19 spreads from person to person through coughing or sneezing. And so when someone coughs or sneezes in a public place, the virus droplets become airborne and can stay in the air or on surfaces where they land for several hours or several days after the initial exposure and after the ill person has moved on. And so if you can see from this graphic, when someone coughs or sneezes, you actually kind of, due to the pressure of of air moving in your lungs and out your mouth. You project droplets of air into the surrounding environment, and those droplets can remain in the air or land on surfaces and stay on those surfaces. And so this is one of the challenges with COVID-19, that is actually quite contagious and quite easily spread in this way. And that many people can become infected without actually knowing where the initial point of exposure happened. Next slide. So at this rate, you've probably heard quite a bit about flattening the curve and the need to flatten the curve. And what that means is, in terms of disease spread, if we map the active cases over time, we'll see that initially, early on in the pandemic, there'll be a spike in the number of cases. And that's because, there are no mitigation efforts underway. The people are out in the world doing what they normally do and spreading the disease, often without knowing it. And so usually there will be a spike in the initial, weeks and months after the pandemic or the disease arises, and then it slowly peters off as time goes on, as treatments become more efficient, etc. What we have to worry about is that often with those high spikes in the initial couple of weeks and months of an infection, the number of cases will surpass the capacity of our healthcare system to actually provide care to people who need it, especially those who are going to develop the more severe symptoms and will need medical help. And so flattening the curve is this idea that if we're able to implement mitigation measures like staying at home, like wearing masks, we can reduce the spread of the disease such that the number of cases in need of medical attention, especially, never go above the actual capacity of our healthcare system to address them. So when people are saying flatten the curve, what they're saying is really, really deploy your mitigation efforts. And hopefully over time, the number of cases will rise more gradually and over a longer period of time. And so this is really the reason for the stay-at-home order. We want to prevent the spread. We want to prevent people who are infected with COVID-19 from spreading it to people who aren't. And for people who do have COVID-19, we want to give them some time to be in quarantine, to work the disease through their systems and to recover without being contagious continually. Now, one thing I will point out is, as we employ these mitigation efforts, as we stay at home, as we wear masks, as we wash our hands, the time at which the disease is active and moving through the population is increased. And so the more we implement these measures, the slower the disease is spreading, but also the longer we're going to be dealing with the disease. Now, on the right hand, this is the worst case scenario. And this is if our efforts to mitigate the spread of the disease don't work and aren't heeded. So the disease actually resurges after that initial surge. There'll be an initial bump in cases as the disease works its way through the population rapidly on the front end. And if there are no mitigation impacts, those who are infected earlier will go on to spread the disease to others. So there will be another peak later in time. Right now, this is a likely scenario given the mitigation or lack of mitigation efforts on a local and national level. And so we're expecting that there might be another peak sometime this summer or this fall. Next slide. Okay, there we go. Okay, so some of these preventative measures I've been talking about a little bit, some of these best practices for avoiding being infected with COVID-19 and spreading it to others are to stay 6 feet away. So maintain that spatial distance between those we're around. This kind of prevents those sneeze clouds or those cough clouds from getting to anybody too directly. Do wear a mask. We know that there's this is a contentious issue for some in our society, but really the best health advice and the best practice in terms of keeping yourself safe, preventing yourself from spreading the disease to others, and preventing others from spreading the disease to you is to wear a mask. And this is to wear a mask while maintaining that social distance. So these preventative measures, when stacked, are actually more effective. So do keep outdoor gatherings small. Try to avoid crowded places because these are the places where someone might sneeze into the air and nobody knows who or where those droplets are landing. Do carry your own hand sanitizer. It's very important to have access to some kind of purifying substance. And whenever, in addition to the hand sanitizer, whenever you have the opportunity, wash your hands. Really washing your hands is going to be the best way to prevent the spread of this. And as you are regularly washing your hands throughout the day, try to avoid touching your face as much as possible, because this is how you're going to carry those virus particles from a surface in your environment to your hands and then to your face and potentially infect yourself. And do, whenever you are meeting with people, when we're trying to maintain the social cohesion while we maintain spatial distance, meet outside with your friends, go on picnics, play outside, play sports, play games. I'm really, now that the weather is becoming, nicer and nicer, this is a great opportunity to get outside for social events. Next slide.
So reopening and testing, basically what does our process look like here in Wyandotte County, KCK? So the health department has established testing for people who live and work in Wyandotte County. And so as of last week, COVID testing is Monday through Friday, 1 to 5 p.m. You can drive or walk up to the testing site. No appointment is needed. And it's for residents who have had symptoms within the last 48 hours, or if you believe you've been in close contact with someone who has symptoms or may be positive for COVID-19. So that is that. And as far as the reopening, what that looks like in Wyandotte County is following the Kansas Ad Astra reopening plan. We are currently following what is called the phase 2 of the Ad Astra. And that looks like restaurants and retail, office spaces, parks, coming back to resume practice with limited or with restrictions or social distancing. As you can see here, the bars and nightclubs, they are pickup, curbside, or delivery only. And then there are a few things that are still closed or virtual during this phase. And so that is basically large gatherings. So most swimming pools, summer camps, they have fairs and festivals on here, and outdoor, indoor entertainment that has a capacity of more than 2,000. So as it stands, phase 2 is supposed to stay until June 22nd at the earliest. That date can change. It can either go up or down, but as of right now, June 22nd is how long we will stay in phase 2 unless otherwise noted. And as we get updates, we'll share that with the community. And also the unified government has been on top of listing resources and services for the community. And they just launched a new part of the 311. So if you call 311, they now have dedicated healthcare professionals, nurses, to speak with residents if they feel like they have symptoms or they want to talk to someone or report their symptoms. So if you call 311 and ask for a healthcare person, they will be able to speak with you about that. They also have dedicated professionals if you have business needs or business questions and you want to call 311 about it. And also the personal services such as mental health, or you need resources for your home, you can also call 311 for that. And then the UG has their COVID-19 resource page, and it shows you the active number of cases in Wyandotte County. Resources, they have those listed out, and a live map of where the cases have been found.
So if we take a step back and really try to get a sense of what we're all waiting for. We're at homes right now. We're waiting for some sense of safety primarily, some sense that it's okay to go back into the world and to resume the lifestyles that we were living before, or to adjust to the changes that are coming up because of COVID-19. So as we're all staying at home, we are all waiting for a feeling of safety, and we're hoping that it comes as soon as possible. We're also waiting for a better understanding of COVID-19. Like I said, this disease has only been around since December of 2019, and so we don't actually understand it very well. We have some experience from the responses in China and other countries abroad as they've had to deal with surges and mitigation for this disease, but really we don't actually understand COVID-19 well enough to talk about the disease in a very specific way. We're also waiting for a vaccine. This is going to be one of the fastest ways we can return to life as normal, as we can. With the vaccine, we would be, largely immune to the spread of the disease. Now, with the vaccine, it can take up to between 1 and 3 years to actually develop a vaccine, and countries around the world are pouring their research efforts into developing a vaccine, but that is going to take a while. It's going to take a while. And the first vaccines to come out may not be the most effective. And so this may be an iterative process as well, where the vaccines get better over time. And while we wait for a vaccine, one of the only other things that we can hope for is an effective treatment regime. If we are able to find other drugs or other treatment practices that can help address the symptoms and the disease of COVID-19 as it manifests in people, that will be a way for us to also kind of return to a normal life quicker, because COVID-19 won't be so dangerous and so unknown. And then finally, we're waiting for a better understanding of immunity. Now, we do know that some people have had COVID-19 even before the pandemic really picked up, and are now showing antibodies in their blood. I want to really be clear that the presence of antibodies in your blood does not mean that one is immune to getting COVID-19 again. Right now, there's very little understanding of whether or not someone can be reinfected with COVID-19 and what that potentially means in the long run. So even if you have antibodies in your system, that isn't a clear go ahead to, return back into the world and without a mask and do everything you were doing before, because we're still waiting for better understanding of what immunity to COVID-19 actually looks like. Next slide. Yes. It's important to remember that this is something we are all in together. The frustration, the fear, the anger a lot of people are feeling about the disease itself, or the response on a national and local level. All of these emotions are shared across the board for the most part. We are all sitting in our homes, often bored, waiting for the end to be in sight. And so I think it's very important to remember that this is a shared experience, and that we can really draw strength from each other and in our communities as we move through this crisis together. Next slide.
Okay, so I guess we're gonna open this up to everyone. If you have any comments or questions about this portion.
This is Elnora. I had a question. I never thought about it before until Cynthia, you were talking about, I think you said something like COVID-20. And so I got to think, what does COVID stand for? It's the COVID. Is that an acronym for something? First we heard coronavirus. We kept hearing that. What is COVID? What is it?
Yes, so COVID is coronavirus. It's a shortened name for it, and so they took the CO from corona and the VI from virus and D from disease. So COVID-19 is coronavirus disease that was first discovered in Wuhan, China, in December of 2019.
Got it. That is. I never would have thought that. Okay, thank you.
No problem. Any other questions? So one thing I do, if there are no other questions, one thing I do want to leave you all with, because I know that this is a lot to take and we've all just been inundated with information about COVID-19 and a lot of fear and uncertainty in the last couple of months. One thing I really want to leave you all with is that COVID-19 has really radically changed a lot of systems already, and it's changed the way that we have done things in the past and the way that we can potentially do things in the future. So this pandemic represents a turning point in our society and the way that we live and the way that we can choose to live going forward, the kind of options that are going to be available to us and the things that we're going to learn to value. And so as we move through the uncertainty and the fear and the difficulty, I really want to stress how this is actually a wonderful opportunity for us to rethink our lives and to rethink what our lives can look like and what our lives can be like, and to come together and create that. I just want to leave you all with this idea that we can, focus on bouncing back and coming back as strong as we were, or we can reframe and focus on bouncing forward and using this as an opportunity to really be intentional and strategic about our lives and the choices that we make as community members and organizations, so that in the future we can live better than we lived in the past. So we can have better options, we can have better living conditions, we can have better everything, And so Groundwork NRG, our work in the next year and beyond is really going to be focused on how do we bounce forward from this as an organization, and how do we support the Northeast area community to also bounce forward so that we can come out of this stronger, more resilient, and more closely knit than we came into it.
Thank you, Cynthia. That was really good. So we are going to move forward to the next item now, and we're going to talk about the 2020 census. So we have been doing a lot of work in the community on getting people, more informed about what the census is and how they can participate, and feeling more comfortable about participating in the census. And so that we just hired our census equity coordinator, Dustin Hare. So he's going to speak a little bit about what we've been doing for the census. But just a brief overview about the census in Wyandotte County. We, as a county, have seen, I don't want to say a lack of participation, because we are participating, but we would like to see participation grow in numbers. And so with the census, they have what they call hard to count census tracts, which are geographical areas where many residents do not complete the census. And so they call it hard to count because they know that someone is there, but there's no data for it because we don't complete the census. And so that is really our efforts as Groundwork NRG to reach out to the hard to count census tracts in our area and get people to complete the census. So I'm going to pass it on to Dustin.
Okay. Hey, everyone. Yeah, I'm Dustin. I'm the Census Equity Coordinator for Groundwork. Before I get into more about what that means, I want to mention that we do have 4 partner organizations here in KCK who are also part of what we are calling the Count Me and MICO Coalition. Those organizations are More Squared, Community Health Council, New Bethel Church Community Development Corporation, and the Village Initiative. And this work is made possible by a grant from the Greater Kansas City Community Foundations. We want to thank them for this opportunity, but also we want to thank them for recognizing that when our community is undercounted in the census, it's an equity issue, and it ultimately impacts the health of our community. So let me get a little bit more into why that is. As you can see here, for every person not counted by the census, we lose federal funding of $2,082 per year per person. That's $20,820 per person over 10 years, which is when the next census count will occur. In 2010, Wyandotte County was undercounted by an estimated 1.43% of the population. Doesn't sound like much, but this means we lost out on just short of $50 million in federal funds over the last 10 years. those funds go for things like education, housing, infrastructure, public transportation, food, healthcare, childcare, public safety, all things that make our community a better place to live. As of right now, and you can check this on the Census Bureau's website any day you want, but only 55% of Wyandotte County residents have responded to the census at this time. If that number were to hold true, we would lose roughly $1.5 billion over the next 10 years. But the Census Bureau hasn't yet begun their work of sending census workers out to people's houses who haven't responded. So that number will improve pretty drastically. But it's important that every single person in our county gets counted. Next slide, please. So what the Count Me in Waco Coalition is doing is we've started what we're calling a Dial a Neighbor campaign. And we're targeting those census tracts that Dejan mentioned are the hardest to count. Essentially, they're in Northeast Kansas City, Kansas. Each of our partners has dedicated staff and volunteers to make phone calls to our neighbors. We relay information to them about the census, and we urge them to make sure they complete their census. Since we began this project at the beginning of this month, our coalition has already called 3,672 people in hard to count Wyandotte County census tracts. When you consider that like 30 to 40% of those people actually pick up, it means we've had conversations with about 1,500 people. And while we're reminding them about the importance of the census, we're also doing wellness checks. So we began doing this at the height of the coronavirus outbreak, and people were extremely appreciative to be hearing from their neighbors. I have a couple personal anecdotes from those phone calls. In one case, I talked to an older woman who was on dialysis. She was very concerned about her health, and she didn't have any family around. So due to the networks that we have here in Wyandotte County, we were able to get her in touch with a community health worker, and that community health worker has been in contact with that woman now. Another time I talked to another older woman who was in the high risk category. She said she was doing fine, but she was afraid to leave her house to go get groceries and other essential items because she didn't have an appropriate mask to protect her. And so, she actually found some online, but they were outside of her budget because those good masks are pretty expensive. So I asked around the community and actually found a neighbor who had a couple extra N95 masks on hand. He was able to sterilize those masks and drop them off on her porch, and now she has the protection she needs. And so neither one of those cases wouldn't have come about if we weren't doing this project. On top of that, once again, we're reminding everybody about the census, which is also extremely important. So I think it's fair to say that this project has been extremely rewarding for me. Folks are typically pretty happy when we're calling, which is not always the case with phone banking campaigns. But we still have tens of thousands of calls to make to Wyandotte County residents. If we want full participation in the census, if we want to receive the federal funding that we're entitled to, and if we want to make sure we are proportionally represented electorally, then we have to make this a community project. So if you or somebody you know has an hour or two per week that you would like to help, we could really use your help in making phone calls. So if anybody is interested in that, you can drop your email address into the chat, and I will definitely reach out to you and give you everything you need to get started. And you can send that directly to me, or you can send it publicly. Also, we do have a pledge form that we would love everybody to fill out, and I will drop that in the chat right now. That's just saying I will participate in the census. Even if you have already participated in the census, it would still be great to have that so that we can send it back to our funders and let them know that our residents are participating. So that's all I've got. Thank you.
Thank you, Dustin. We're going to open it up now to anyone if you have any questions or comments.
This is Eleanor. I have a question of Dustin. Is there any way of knowing the impact of the federal funds directly in the Northeast? And even, excuse me, even at those census tracts that are hard to reach? Excuse me.
That is a very good question. To be honest with you, the data is pretty incomplete. The number we have of the 47 million lost in Wyandotte County over the last 10 years was a study done by a university in, I think, 2017. So that's where that comes from. And they analyze every single federal program for every county. So when it comes to specific census tracts, I don't think we have the kind of detail that would give us the information that you're probably looking for. We can probably make some good generalizations based on what we know, but I haven't personally seen that data. And if it's out there, then I would love to see it.
You know, and that makes sense. Some of the feedback that I've gotten is, well, you say, you know, you say that that it's going to impact us. We will not have federal funds. Can you give an example, or will you give an example, Elnora, how the funds have been used in this particular area, especially as we see a reduction in resources and infrastructure? So
I see.
Thank you so much.
Yeah, I would say like SNAP, Supplemental Nutrition Assistance Program. The funding for that is based on census information. Infrastructure, you know, when money is allocated for roads and levees and that sort of thing, that is somewhat based on the census. I can't really tell you the specific projects that have occurred this decade, but those types of things definitely come out of the census data.
All right, this is Yvette. Also, when businesses are looking onto whether or not they want to come into an area, they look at the census tract to see how many people that are recorded to be in an area. So like when we have been going so long without a grocery stores look in the area and say, oh, well, you don't have that many people there, so we're not going to have any customers. That's because people have not filled out the census that lasts for 10 years. So yeah, we know people are here, we know we eat, but the census doesn't report that. So any other business that wants to come in, if they don't see the population that they feel they need to bring their business there, they're not going to come and do business in that area where they're not seeing the correct amount of populations that they want to see.
Good point. Thanks, Yvette.
You're welcome.
And then I think Commissioner Bynum had raised her hand if you want to speak.
Hi, thanks. I got on the call late, so I was gonna ask if you could start over at the beginning. I'm just kidding. With regard to the census parts of the conversation, I had a couple of thoughts. I put one in the chat. At Shepherd Center where I work, I've got a contract employee who's been working very hard on the hard to count populations. And of course, during the COVID-19, that became extremely difficult, and we started trying to do whatever we could do, including making phone calls ourselves. But I'm wondering if Dustin, if I dispatched her over to you, whether she might be better utilized. And then Dean Catterndall over at Mid-America Regional Council had emailed me a map that had identified some very specific census tracts, I think in the Northeast area, that the counts were coming in low. And I can certainly send that to you. It sounds like you've got a pretty innovative project going here in terms of trying to reach out to these hard to count areas. So anyway, I would offer my person to you if you want her. I think it might serve us better as well. And
yeah,
then
we would be thrilled to have that person.
Great. I'd like to connect her to you, and obviously that's beneficial to us as well. And then just, you know, a few items of everyone understanding why the census is so important. I mean, it does, it's the barometer for allocation of health dollars and transportation dollars and dollars for our public schools and so many other things that I think people have stated here. But for in my world, older adult meals. So yeah, if there's I'm sure you're already doing this, highlighting those things that really impact the Northeast area, that helps paint the picture of why we really need those census counts to come in accurately. Thanks a lot. That's it.
Great. And I'll send you my email address in the chat here, so you can send that contact over to me, and that'd be wonderful. Thank you.
Thank you.
Anyone else? Okay, I just wanted to say again, I really, really enjoy everyone's wearing their blue and green today as part of our Groundwork energy colors. Because we just launched in February, we really haven't had the chance to really celebrate that. So I'm so glad to see our colors in full force here.
Yeah, this is Jonathan. Yeah, great colors, blue and green. I mean, I believe there's an organization or government organization, I think they're known as EPA, that I think also uses blue and green. So I think your color scheme is great. I've always been partial to blue and green, probably all the way back when I was in 8th grade. I've always gravitated to those two colors combined. So kudos with that color combination.
Thank you. Okay, so moving on, something that we've also did during this time is launch a community survey. So we sent out an email to our contact list of close to about 500 people, requesting for them to complete this survey to really assess the needs of the community at this time. We don't want to assume what the community needs and what services we should be providing. We really want to hear from the community about what they need. And so we have gotten a good response, and we're still going to continue accepting survey responses at this time. And so after the end of this meeting, you'll receive a follow-up email from me with the survey link in case you haven't filled it out or you want to share it with others. And then I'm going to pass it on to Brendan now, who's going to talk a little bit about our fundraisers and the chili cook-off.
Hi, everybody. So I both have, I'm talking about two topics. I both have a lot and a little to say, just because we all know COVID-19 kind of changed the game on a lot of things. So with the Groundwork NRG fundraisers and chili cook-offs, we postponed the chili cook-off right near the very beginning of the stay-at-home order. And we had kind of experienced before that some people were buying tickets, but they weren't actually buying tickets. They were essentially donating $10 with no intention of coming to the cook-off because they were already starting to kind of get afraid and started pulling back, which makes sense. And that's why we decided to postpone. Right now, the fundraising committee and myself as staff contact are trying to figure out when we want to have that chili cook-off. It's going to happen. We're just trying to figure out the best timing, because if we do it too early, no one feels safe. And, the biggest part for us, I know as a staff of the chili cook-off, is getting the community together, having fun, and really building those community relationships. Like, we very rarely interact with our community in a groundwork capacity when we're not trying to solve a problem or educate somebody or something like that. So to have an informal, just needing to have fun is huge for the staff. I think it's great for the community. So trying to figure out the timing where people will actually feel comfortable meeting at a large building again is difficult. And like they said, with what we know about the virus and all that, between science and, the head and the heart, trying to figure out the best time for it. It is going to happen. In the meantime, we're kind of experimenting with some ideas for virtual fundraisers, so we could still kind of have that fun and connection to the community, but socially distant and safe. I actually had some of the Learn to Earn kids give me some ideas that I think they gave me 5 ideas for were straight impossible, but one might actually work. So we're kind of brainstorming, workshopping some of that. We're actually meeting later next week to kind of introduce a couple new members of the fundraising committee and kind of see how we want to continue in this climate and what fundraising chili cook-offs look like from now on. So I have on that. So we're doing a lot, no hard dates or anything like that as of yet. So now I'm going to move on to Learn to Earn, which is a similar situation. I've already had 2 different meetings this morning about the summer program. Stuff's changing on the fly. We have a lot of really good, really cool things that we're trying to get guarantees on. We just wrapped up the spring program. We shifted very fast with the spring. We went virtual. We had all the kids meet via Zoom with their school computers. And good news is the schools are letting them keep their computers over the summer, so we don't have to worry about any use not having access to Zoom. We learned a lot in the spring program. We didn't miss any classes. We seamlessly went from in-person, their spring break, they declared the stay-at-home during the spring break, and we instantly went into virtual classes. We pivoted to do more project-based social media kind of design work with them. They were helping us with some work for the census. We were able to get a contract with DUG to get the kids a little extra money. We'd like to continue that kind of process in the summer, getting the kids achievable virtual projects, applying everything we learned in the spring, and the good and the bad of the spring. The kids liked working in Canva. They liked doing social media. They liked being creative. They just wish they could be a little more interactive. So with the partnership with Workforce Partnership, I actually have 2 facilitator assistants coming on to help me with the youth. So when we're on Zoom, we'll be able to break out to smaller groups. They will have more adult interaction. I have 2 right now that are coming on, both 18, both have years of experience working with youth. Some of them actually planned activities, programming for youth. So it's a great fit. We're really trying to up the amount of time the kids get one-on-one, because a Zoom call with 20 people is kind of overwhelming for a lot of them. We want to keep it virtual. We want to kind of pivot and include not only community education programs, but also try to see if we can do some posts for local businesses, because a big component was sending kids to actual job sites to learn about workforce development, actually working in the real world. So we'd like them to do some of these projects for a local business to help them get the word out, make sure they have an online presence, because some of them don't. I've also been talking to Young Women on the Move. They have a great Class in a Box project they are launching, where the kids will get 2 packages a week. One will be materials, ingredients for a cooking class, and the others will be materials for an art class. We're working out some of those details, and I'd also like to have a couple days a week, we're still trying to figure this out, of getting youth to go on-site, socially distant outside, and maybe help build these boxes so they can see the logistics of how you get something in the mail, that it's not magic, and that there's a lot of work that goes into it, so they're exposed to more career options. I've also talked to a few places that would like youth to come in small groups and help them design and maybe paint or do something of a building they're trying to convert into a youth center. So we have a lot of cool projects in the works. I'm just trying to figure out the best ways to keep our kids safe. We have a big donation coming in from Knit Right of washable masks. I asked for 40 so I could give all the youth 2. They actually decided to give me 80, which is unexpected, but very nice. They've been a huge help. They're very, if you're running a non-for-profit and need some masks, I would highly recommend going to Knit Rice donation page. They've been great. I talked to the actual VP of Knit Right, and they've been amazing. So that's where we're at right now with Learn to Earn Summer. I'm hoping to supplement the virtual classes with at least 1-2 days of getting them outside, masked, distance, and doing some kind of hands-on work, because I could tell the kids are getting antsy and they just want someone to talk to. So that's why I've upped the adult/peer mentoring we're going to have this year, and really trying to make sure that we give the kids the time they deserve. We're going to take a pause. We'll probably start a little later than our original start date of June 8th. Probably add 1-2 weeks to that, just so we can make sure the program's as robust, as engaging, and as safe as we can make it. Taking on steps, but stuff changes every day. So fingers crossed I can get us out of a solely virtual class, but still keeping the youth safe and engaged.
And just to touch on that a little further, the Learn to Earn Spring students did an amazing job with taking on the census and learning about the census, and then using their skills and talents to create a social media campaign for getting more people involved in Wyandotte County and participating in the census. So stay tuned to our social media, because we will be featuring the designs from the youth onto our social media every few days, and they look pretty great, and we're really excited to share them with you all.
I will say I'm glad to hear someone else was blown away by the youth designs. Some of them really pulled it out. Either they gave me one great design, some of them gave me like 5 great designs. They really gave it their all. Some classes I couldn't even get the kids to leave for 30 minutes past time. So we're in an interesting time, and we're really trying to keep what I've learned from doing virtual into physical classes and beyond. I think we've really learned how to tap into the youth creativity and really get them engaged and helping local businesses and the community at large.
Thanks, Brendan. So now we're going to pass it on to Cynthia, who's going to talk a little bit about our new initiative under Groundwork NRG, the Green Redevelopment Team.
Yeah, thanks, Sejan. So Groundwork NRG is in the process of developing a larger project around green infrastructure, and what that looks like. There will be details to come, so I'm not going to talk too much about that now. But as a Groundwork Trust, one of the flagship programs of any Groundwork Trust and of Groundwork USA as a national organization is the Green Team. And so the Green Team is a group of youth ages 17 to 21 from Wyandotte County in Northeast Kansas City, Kansas specifically, who will be trained and hired to provide environmental stewardship services to the community. And so this will range from training in trail building to invasive species removal to installing green infrastructure projects like rain gardens and other stormwater projects, to potentially manning our minor home maintenance program, which is also in development right now. And so I just want to let you all know that this is an opportunity that's coming down the pipeline. There will be more information as it's further developed. But if you know any youth between the ages of 17 to 21 who would be interested in being hired and receiving some job training and potentially being employed in a new field, in a new sector in Wyandotte County, Kansas, green redevelopment, environmental stewardship, that kind of work, then please do reach out to us via the website, or you can contact us directly and let us know who they are. And we will love to bring them into the team.
This is Eleonora. I didn't get unmuted, Brenda, before you left, and I do want to just give high marks to you for everything that you've done on that Learn to Earn program. You know, you make it seem so easy to work with the group of young people. I've seen you operate. I don't know how you do it. I really don't. So thank you very much for the Learn to Earn aspects and what you're doing. And then Cynthia on the Green Team, I've seen you work, be with the Youth Build You didn't know I saw you, but I saw you, and the ease and stuff and the fun that you were having. So you both had that great connection with the youth, and I remember having great connection with older people and and learning. So great role modeling, and I appreciate you both.
Anyone else have any comments about Learn to Earn, the chili cook-off, the community surveys, anything?
This is Jonathan. I just had a comment, maybe kind of related to potential fundraisers, and I know it's kind of been challenging during these times, but I don't know if there was something you might want to consider to getting people out there walking and whatnot, to maybe do something where there could be a fundraiser for for every participant to maybe involved in like a 5K walk or run or whatever it is, length, and participants could have a means to put in for a like a fee or whatever, a contribution of a certain amount of dollars, and then after they're done, they could show their time. Not everybody's got like a like an Apple Watch or a Fitbit that shows exactly the distance and everything, but and documenting it. But you could kind of make it as friendly as possible for everyone, and it might be a means to raise some money, as well as having people get out there and do some physical and mental good for their mental health as well. So just a suggestion.
I like that idea a lot. Especially if they can just submit their time instead of having like a winner of the race.
Right.
Or something, yeah.
Yeah, and then you could maybe have some fun, front prizes or kudos or whatever, and you could get maybe some of the community members, involved in that part of it too. Just a means of bringing the community closer together during these fun, challenging times, and people getting outside, and not being afraid to get outside, and still be able to, practice, safe distancing, because it'd be kind of a virtual thing.
I really like that idea. I think I saw some note popped up about just pledging for miles. Like it could be something we do over a week, even like.
Right. You wouldn't even have to have it at a certain time. You could just say, get this done within X amount of days, and then just forward to whoever the point of contact is, your time or whatever. And it could be done as a run. It could be done as a walk, however, people want to do it, because that way you can get great amount of participants involved with it. And it's not about the time. It's just about going out there and getting outside and enjoying their time, and feeling like they're doing it collectively while they're doing it on their own.
Oh, Dustin knows an organization that's doing this. Yeah, we'll definitely like take anything information wise from them. I love it.
Cool.
Thank
Thank
you.
you very much.
Sure.
All right, so another exciting thing that we've been waiting for is announcing the winners of our color theme. And so we're gonna go ahead, and Brendan, do you want to tell everyone what we're giving away?
Yes, I can do that. So we have, I wish I had pictures of it. Should have a little more. We're giving away little care packages with a pedometer, a wrist pedometer, a t-shirt designed for our KC Healthy Voices. They're very nice t-shirts. Ed bags the same design by, do you remember the artist's name? JT Daniels? Is that right? Yes, by JT Daniels.
Yeah. And this is some of the artwork that was featured during our 1.5 year long KC Voices project around the Farm Bill. And it spent time at the Jackson County Legislature. It spent time at City Hall. It just kind of traveled all around. So it's a really wonderful piece of artwork that we commissioned from JT Daniels, and just really beautiful and vibrant. It's a tote bag and then a shirt as well.
All right, so our first winner is Miss Sylvia King. I'm gonna spotlight your video so everyone can see your colors.
That's cool. I didn't even do that.
Can you hear us, Sylvia?
I know Sylvia was having some difficulties earlier and had to tune in through Facebook, and Facebook is on a delay.
Oh.
I'm
So Rachel, you'll be accepting on behalf of her in the academy.
I'll text her right now and let her know that she.
Oh, she sees now.
You won, yeah. Great job. Thank you so much.
All right, our next winner is John Harrington with his green and blue. And then we have Alyssa with her blue on.
Yeah.
And Mr. Bob, we see you in your blue. And then Jill, before her camera was off, we seen you in your green sweater.
Oh. Oh, thank you. That's so exciting. And Rebecca wants to say hello too.
Hello to Rebecca.
Hi, Rebecca.
Well, thank you.
So we're gonna be in contact with you all so that we can arrange a safe pickup for your care packages. So be on the lookout from either an email from Brendan or I. And thank you for wearing your colors. And so for community updates and announcements, before the whole COVID-19, we were doing classes in partner with KU to I guess, get the experience of people who have either had cancer or experience with family members with cancer. So we are starting that back again. Rachel, if you want to talk a little bit about that.
Yeah, so we're this is one of the projects that Jill mentioned earlier that we're working with her on, the community-based participatory research project with KU Med around cancer in African Americans, and we're really looking for the experience of both survivors and co-survivors, so people who have cared for someone who had cancer. And we're doing focus groups, and there are incentives to participate in the focus groups as well. If Jill is still on, she can actually talk a little bit more about the fact that we're going to be actually putting together some virtual focus groups here soon.
Yeah. So we have to collect all data now virtually, if possible, per our regulations from the Medical Center and the Research Institute. So we are going to do our focus groups using a secure platform such as Zoom, and we will offer them with video or just with audio. And we do audio record our focus group sessions, but we won't record it with the Zoom function so that we're not recording video. We're only going to record audio. And so those focus groups will last about, I think, an hour to an hour and a half. And what we're wanting to find out are the experiences of being diagnosed with cancer for the individual who receives the diagnosis, but as well the family member, because we know that cancer and all chronic diseases affect the family, and we're wanting to find out what the experiences are what are barriers to really health and well-being from a very holistic perspective. So physical well-being, spiritual well-being, social well-being, and emotional well-being. And as Rachel said, we're providing a $25 gift card to all survivors and co-survivors who participate in the focus group. Now, how that's going to look with it being virtual is a little bit different than when we were doing in-person focus groups, and we could provide the gift card at the end of the focus group. And with them being virtual, we'll have to mail those. So there's a little bit of a delay in receiving those gift cards, but we'll try to expedite that process so that people don't have to wait very long.
Thank you. We will share that on social media as well as a recap from this meeting afterwards. We're going to open the floor up if there's, you're welcome. If anyone else wanted to share any community updates or announcements.
I do actually. One more project I forgot to mention we're working on right now is we've also partnered with Casey Healthy Kids. We're conducting similar focus groups. We're looking for families of young children 5 and below to see what challenges these families face in their communities, because Casey Healthy Kids, they're launching a Healthy Kids Bright Future campaign, and we want to make sure that the monies, the projects and everything we're doing is based on what the communities actually want, what they actually need, as opposed to what we decide they need. They get a gift card for $25 and a delivered box of fresh produce from Split Log Farms right there. And they're actually encouraging the families to try to get a free plot of land and plant their own fruits and vegetables there. Super cool program. It's been a little tricky to track down families in this new kind of virtual environment. But yeah, if you know anyone, they just have to have children 5 and below and be in Wyandotte County. And they can just shoot me an email, submit something on the website, and I'll happily talk to them. It takes about an hour and a half maybe. But really, we're just gathering their opinions. So that's my big one. Free money.
Hi all, this is Randy Lopez. Can I share a quick announcement?
Sure.
Hi, sorry I was so late to the meeting today.
Randy gonna pop up at the end with an announcement. I love it.
Right, I know, right? And I'm not wearing blue or green today. I'm so sorry. One quick announcement for anybody that you might know who might be food insecure or need some extra resources with food. Tomorrow there is a food distribution at Grandview Park Presbyterian Church. It begins at 9:30 a.m. No information. I mean, it's free for anybody in the community that needs some, or if you know of somebody that can't get there, you can go and pick it up for them. They're prepackaged. We put all the food together, so you just have to show up. If it's your first time going, you just you give your name, number of people in the household, and that's about it. They're going to be doing that every Saturday for over the summer. So tomorrow's, they're having one tomorrow. So that's at 1613 Wilson Boulevard. It's a block south of Central. I'll throw that in the chat box as well. 1613 Wilson Boulevard, Kansas City, Kansas. It's a block south of Central. And you can drive up or you can walk in, and we'll help carry the food to your car if you need assistance as well. But that starts at 9:30 tomorrow. Folks usually start arriving around 9:15 to get in line. They do practice social distancing. I would recommend, if you have a mask, wear your mask as well. But anyways, I just want to make sure you guys were aware, and it's open to anyone, regardless of where you live. So thank you.
Thanks, Randy, for sharing.
I just want to tell people that there is there's free jazz going on Sunday through Friday through July 3rd, and it's being produced at the Gym Theater, or they're doing it at the Gym Theater, and it's streaming, and it's free. And it's either at facebook.com/American Walk of Fame, or if you don't have Facebook, AmericanJazzWalkOfFame.org. And so they just have various local artists that are performing from 5 to 6 p.m. Sunday through Friday. This was the first week, and it goes until July 3rd.
Thank you, Yvette. If you can put the link in the chat.
Okay.
Is there anyone else who wants to share? Thank you so much, everybody, for sharing that. We're going to just let you know all of our social media handles. So we are Northeast KCK for everything. So our website is northeastkck.org. Facebook is facebook.com/northeastkck. And our Instagram, which we are pretty new to, is instagram.com/northeastkck. So if you want to get in contact with us online, that's the way to go. And then also you can contact us by email, info@, you guessed it, northeastkck.org. So that is all we have for you guys. If you have anything else for us, please let us know.
Well, thanks so much. Have a great weekend to everyone.
Yes, it was a great meeting. Thank you very much, everyone. Enjoy your weekend.
Yes, great gathering. Really appreciate the invite. Look forward to the next. And until then, events in your community.
Thanks so much, everybody, for showing up. We love you guys. Have a great weekend.
Bye.
Bye.
Thank you.
There. Got curious.
Did you get that